heart disease was first diagnosed, I thought, why me?
I was in shock because I didn't think that would happen to me.
I was real angry that I was not yet 45 and that my body had let me down.
When I was booked for the surgery, I thought it's all done now for me.
I felt quite anxious about it. I didn't really know what to expect.
I was really scared stiff.
People preparing for heart surgery often have anxieties, questions, and concerns. We want to help address your concerns by explaining what you can expect. The more you know ahead of time, the more prepared you'll be, and the better you can direct your energy toward a speedy recovery and improved quality of life.
I guess the hardest part was the unknown part, but once I found out things and had a greater understanding, then things were much, much better.
I had been so sick and had felt so awful, and if this was going to make things better, then I just really wanted to get on with it.
The surgeon is ready, and the hospital's ready, staff are ready. It's up to me to get ready.
It's very typical that many patients and families don't understand everything that may be presented in the video, and you may require a little more explanation of different parts of the information. So do ask the member of the healthcare team about it. Don't wait for them to explain, because they may assume that you do understand.
You'll be admitted to the hospital for your heart surgery. Depending on your hospital, this will either be the day before or the day of your surgery. You'll need to bring your health card, hospital card, and information about any other health insurance you may have. While in the hospital, it's reassuring to know that you have a team of experts looking after you. The team will include a surgeon, nurses, an anesthetist, a cardiologist, and residents. Other healthcare professionals may also be involved in your care. Your team may also include a volunteer, someone who has had heart surgery before. The volunteer can give you support based on first-hand experience.
Do you feel okay?
Not too bad.
You'll need to bring some personal items with you when you come to the hospital. When you pack, remember to include all the medications you're currently on in their original containers. A front-opening robe, comfortable shoes or slippers with good support, and all your own toiletry products, including toothbrush, toothpaste, hairbrush, deodorant, and razor. Women should bring a loose, comfortable bra.
Did you bring any valuables with you?
Yeah, I have my wallet here. It's in a drawer.
Okay, make sure your wife takes it home with her.
Don't bring valuables, such as jewelry or your wallet. However, you may want to arrange with someone to bring money for you to cover the rental charges on the TV and telephone in your room.
When I got into the hospital, and after speaking with the nurses and the doctors and so on, I felt quite relaxed.
And what helped me at that time was the volunteer who came in and told me about the bypass surgery that he had had.
I was helped a great deal by meeting a patient who had had the same operation a year previously.
My name is Cindy. I'll be your nurse today. First, I'll check your temperature.
Preparing for surgery begins with a preoperative checkup. Routine tests include a chest x-ray, blood work, and an electrocardiogram, or ECG. Depending on your hospital, this may take place after you've been admitted to the hospital or up to 2 weeks beforehand. A member of the surgical team will review the type of surgery you're having and discuss your medical history.
Do you find that you're able to do everything during the day that you want to do without getting chest pains or shortness of breath or feeling too tired?
In addition to your daily activities, you'll probably be asked about your diet and any special food restrictions or requirements you may have, medications you're on, and whether or not you smoke.
Before surgery, we strongly advise our patients to stop smoking. Smoking produces increased secretions and makes the patient's job harder early after surgery in clearing these secretions and coughing. So this really has to be a lifetime commitment once you've had this operation to stop smoking and stay away from cigarettes.
Hi, good afternoon. I'm Dr. David Chang from the anesthesia department.
Prior to surgery, you'll also meet your anesthetist. You'll be examined and asked questions about medications and allergies. Other preparations for heart surgery may include a shower with special disinfectant soap, clipping the hair on your chest and your groin area, If you're having a bypass operation, your leg and/or arm hair will be clipped too. You may also receive some type of bowel preparation, a suppository or enema.
My name is Eileen, and I work as a physiotherapist in here. I'm here to show you your breathing and coughing exercises.
Deep breathing and coughing exercises form an important part of your care routine after surgery. Before surgery, a nurse or physiotherapist will show you how to perform these exercises, so you can start doing them right after your operation.
Good for you. Catch your breath. Are you ready to try another one? Let's go. Take a deep breath in and in.
And do you have any other questions for me?
Well, one question that's concerns me is the amount of pain after the operation.
People's experiences of post-surgery pain and discomfort vary widely. Taking your pain medication will make you more comfortable and make it easier for you to do the walking and breathing exercises that are so important during recovery. Adjustments to your pain medication will be made to suit your needs, but you have a part to play in this too. It's up to you to ask your nurse or doctor about what kind of pain to expect. Take your medication regularly, and tell your nurse if the medication you're taking is not easing your discomfort.
Pain after surgery was not really that extensive, except when I coughed there was a sharp pain for a second in my chest.
The soreness was quite intense just after the operation for the first few days. Then it began, each day you begin to heal, you begin to feel better.
The pain was nothing that couldn't be handled with Tylenol and a bit of patience.
Good morning. We're almost set to go to the surgery this morning. The stretcher will be coming here for you shortly.
You won't be allowed to eat or drink anything after midnight the night before your operation. However, on the morning of your surgery, your nurse may give you some medication, which you can take with a sip of water.
And just lie down here and we'll be all set.
Just before your surgery, your eyeglasses and dentures will be removed and held for safekeeping. You'll then be taken to the operating room. If friends or relatives want to wait, they'll be directed to the waiting area. Your surgery will take anywhere from 3 to 6 hours.
Heart surgery is performed through an incision in the midline in the breastbone. Once the chest is spread open, the patient is connected to a heart-lung pump to support the circulation. We're then able to stop the heart and perform either a valve operation on the inside or coronary bypass on the surface of the heart. At the end of that procedure, the breastbone is then wired together with stainless steel wires. These wires firmly hold the breastbone together and do not need to be taken out and cause no problem later. Obviously, there'll be some discomfort for a while, but this disappears within a few weeks. Patients often ask about blood transfusion during open heart surgery. With the modern techniques of blood conservation in and around the operation and during the intensive care period, we rarely use blood at this time. For those patients who we anticipate blood requirement, autologous blood donation, that is, donating one's own blood, is possible in the weeks preceding the operation. Not all patients are eligible for this, and you should ask your surgeon about that.
After your surgery, the surgeon will speak to your family and friends.
Everything is fine, your grandfather as well. The operation was very smooth, and I'm sure he's going to be just fine. He'll be going.
Meanwhile, you'll be taken to the intensive care area. Here, doctors and nurses monitor your temperature, heart rhythm, blood chemistry, and blood pressure. You won't be aware of what's happening, though, because you'll still be asleep.